the other room, okay? So on and off switch, and then the buttons, okay? Do not bury the touch screen because that's gonna shift and move things. Yeah, so I don't have students barrier that. And then
do you ever tell people that?
Then we're gonna change it to practice location. I'm gonna click on the first Dexter. So you're gonna click on your Dexter number. You're gonna launch capture. Did we not delete it? No, we didn't. Okay. Launch capture. All right, capture image. Capture image. The blue S is right here. You're gonna hold, okay? And then you are going to grab your patient and set up your patient. All right, Matt.
Would it be difficult if you don't see my ears?
I did it with band, and I just used the cheek.
Okay.
So the cheek to line up. All right, so this is the control panel. It can move, as you can see, right? So the buttons here, this is up, this is down. This light is the laser beam that's going to show you your mid-sagittal plane, your Frankfurt plane where it needs to be. These are the head traps. So this is the forward head trap. These are the lateral head traps, okay? And then this is the reset button. You push R. If you read down here and it says R button, means that I have to reset the machine, okay? So I'm actually going to press it. It's going to move, so everybody step out the way. You always want to reset before you put the patient in there, because this piano machine is not going to do that, but I've seen piano machines that move in all different types of directions, and you press reset and it's knocking the patient's head because it's not in the right position. Okay, so reset before, okay? It should be on test mode. I'm going to take it off test mode right now. This is how you know it's not on test mode. It doesn't say T and there's little humans, there's people. This is when you are going to adjust based on your patient, okay? So you have your small child, you have your not larger child, but older child or smaller adult. You have your standard person, and then you have somebody who's like super tall or larger, bigger patient, okay? So you would change it according to that, whatever your patient presents with. Normally we're going to be on P1 because that's piano 1, but it does have different settings and you can change it here. So P2, that's a different type of piano. Sorry, I can't see from here. Okay. Then so we can keep going, and then here we have our extra oral bite rings, so we can use our different bite blocks. Like we have an extra oral bite ring that we can use to take extra oral bite. Extra oral bite rings on our patient. Okay, it's readjusting because I changed it to bite ring.
Okay.
Yeah. So we have this for extra oral bite rings. You can also use this for extra oral bite rings. We have this bite block for patients that are edentulous. So if they don't have any teeth to be able to bite, we still want to take a piano, we're going to use that, okay? But for most of the time, we're going to be on P1, okay? And then I'm going to click test. The people are gone. We're on test mode. It's not going to produce any radiation, okay? All right. Okay. So before she steps in, what do you want to make sure?
It's on reset.
And I need a...
Oh yeah, the
apron.
life jacket.
Yep. And if she has anything that she can take off her head, like jewelry,
And jewelry.
necklace, glasses, yep.
Yeah,
You guys earrings.
So right now, so you don't have to, but normally you would tell your patient you gotta pick up the earrings.
Yes. Do we put it more down?
Yep.
Like more.
Yeah, she said like the straps, these black parts are a little bit more down.
I'm sorry, I gotta move your scale. Okay, all right. I don't want it to show up on the X-ray at all. There we go.
Show what on that? I'm sorry.
No, lead apron, because it was, this was pushing on it. Yeah, yeah, I'm sorry.
There you go. And then,
So now he's gonna adjust it, make sure that the mouth part is close to your mouth.
Okay.
Yep.
it starts to crank after a second.
Yes, it does. And then, yep, you're gonna come forward, and where do you want her to bite?
Have you bite down right in between there on like the little divot.
Yes, perfect. All right.
I'm just gonna, oh, nice.
And then you're gonna turn on the lights. Yep. All right. Perfect. So now we have our mid-sagittal plane. This is our Frankfurt plane. So I think our Frankfurt plane is pretty good. It's right at the height of her, like her cheekbone. We usually would look at the tragus, but we can't. And then where does her mid-sagittal plane need to be?
Like a little more. I'm trying to look in the mirror.
You can move it and see it. Yeah.
Yeah, would it be?
In the middle, in between 8 and 9.
Oh,
So you
okay.
can see that the line is right on number 9, right? So we have to move it to the middle. Here we go. In between. Perfect.
Oh, we don't move, the light moves?
You move. You just
I
move
know.
for him.
Yeah.
Yeah, you just did. Yeah, you just did.
Okay.
Yeah, perfect. All right. Perfect. All right.
And
Then
do I
what's
do
next?
the front one first or the lateral?
What are we doing?
Oh, then you're gonna put your arms up here.
Okay.
And then move a little bit forward so we can have her back pretty straight. Awesome.
Oh, nice.
All right, now you can trap her in.
And then,
So that's open.
Oh.
Closer to the head
Oh.
is closed. Yeah.
there we go. And then these look close on the sides.
That's smooth. Okay.
There we
Now
go.
what else?
And then I'll have you swallow and keep the tongue on the roof of your mouth. And is there any other?
And then she did it for you though. She closed her mouth.
Oh, the lips, yeah. Because you want to check the smile
Yeah.
first. Oh, okay.
All right. Perfect.
There we
Okay.
go.
All right. So now you're gonna finish it up. You're gonna press your blue S. Because now your patient's all set. So now you can't go back and adjust. Panel should light up green, and then
Here we go. And I'll have you stay real still. And the machine will spin around for like 10 seconds, 15 seconds. And do you ever hit R like right after it's done exposing, or do you wait until?
no, I
like,
hit
it's all
R
done?
after to be nice to
Oh.
other providers.
Oh.
Yeah, yeah.
There we go.